deal with a range of matters through the Health Justice Partnership. We got a lot of different referrals from different health workers. So through having the Health Justice Partnership, it's about early intervention, so we can get in early to address those legal issues. And also address the unmet need. Through being on site in the corridor, the workers can just walk the client to us, and it's very easily accessible. If the health worker said to some clients, and I've got quite a few in my mind, if the clients were told, okay, here's a number, go away to this lawyer's office, they'll help you. A lot of the clients wouldn't do that. So that's the importance of having us on site here.
So HJP traditionally is a collaboration between a health service provider and a legal service, which in essence places a lawyer traditionally in the context of a health centre. Obviously there are nuances around that. Sometimes it places, for example, a social worker in a court setting, but in essence it is placing a lawyer in a health setting so that they can provide legal advice or legal casework to people who might need it.
The relationship between the Loddon Campaspe Community Legal Centre and Bendigo Community Health has developed in such a way that it has been absolutely multifaceted in the benefits that it's brought to the organisation, senior managers, staff members, our clients. It's across the board.
So sometimes these people need the assistance when they need it. They don't plan it, it may not be as organised as people not in a similar situation. Often their lives are chaotic and they've got lots of demands, and when they've got this demand they need the assistance. To say next week, often that doesn't happen.
So I guess any organisation such as a community legal centre really wants to increase its reach into the vulnerable and disadvantaged community that it serves. This was primarily a mechanism to do that. So it enables our centre to reach those clients we might not otherwise reach.
Referring our clients to a legal service, I think, has always been a bit problematic. To support them in an informal way, to be able to advocate for our clients and then help them to understand processes. And sometimes, there might be an additional process that needs to happen, and if we don't understand that, we can just go back to Jess and feel really comfortable in saying, we don't get that, can you explain that please? Whereas if we were to refer to an external legal service, there's just not that relationship.
First up, we've assisted around 130 clients from 2014 to 2016 with casework. We've also assisted 175 clients with advices. So these clients would not otherwise come before our service. We wouldn't be able to assist those clients. Some of the actual findings from the evaluation are that it appears that by having a lawyer embedded in their service, we've increased the capacity of not only the workers per se, so the worker might be an AOD counsellor, a drug and alcohol counsellor, or a family services counsellor. We've also improved the capacity of the organisation to offer these sorts of services. So I guess really what it's done is it's removed some reticence both by worker and some reticence by clients, such that they're willing to engage with a lawyer. That wouldn't otherwise happen if there wasn't a lawyer on site who's visible, available, willing to take on the referrals that the professional workers over at Bendigo Community Health might have in the course of assisting their clients.
So to be able to just walk down the passageway, grab Jess, say, this is Joe Bloggs, Joe's needing some help around some fines, it's really impacting on his wellbeing because he can't buy the food for the kids this week, and also there's a tenancy issue or something like that as well. Because of the warm referral process, because of, our clients trust us, and so therefore if we trust Jess, then she must be okay and she's going to look out for me. So it's all about the relationships, it's all about the connections.